we're going to look at the anterior features of the external parts of the heart. And first thing we want to do is distinguish right from left. And this is a pulmonary trunk. It's going to lead to the lungs. And the pulmonary trunk is attached to the right ventricle. Another thing to note, this is a superior vena cava. The superior vena cava is attached to the right atrium. So this is the right atrium, right ventricle, left ventricle, and left atrium. And remember, when talking about right and left, you're talking about the patient's right and left, not necessarily what's on your right or your left. Now, another obvious blood vessel is the aorta. And the aorta directs blood from the left ventricle to everywhere else in the body except the lungs. And coming off of the heart, you have the ascending aorta, the aortic arch, and the descending aorta going along the back of the heart. And branching off of the aorta, you have the brachiocephalic trunk, which branches into the right subclavian artery and right common carotid artery later. This is the left common carotid artery and left subclavian artery. Coming off the superior vena cava, you have the left and right brachiocephalic veins. Actually, blood coming in from the brachiocephalic veins attached to the superior vena cava. This is the right coronary artery, and it's in the right atrioventricular groove. You have a little bitty piece of the left coronary artery right here, and then the left coronary artery branches into the anterior descending artery and the circumflex artery. Another thing I noticed looking at the anterior view of the heart, you have the left atrium coming in from the lungs is the pulmonary veins. Now usually arteries are red and veins are blue, except for the pulmonary ones. Arteries are usually red because that designates oxygenated blood. Veins are designated blue because that designates deoxygenated blood. But think about coming in from the lungs. The blood's just picked up oxygen, so these pulmonary veins are blue. And the pulmonary trunk, which leads into the left and right pulmonary arteries, they're directing deoxygenated blood out towards the lungs.